Welcome to the deep dive. Today we're going to cut through all the medical jargon around diabetes blood testing.
Great.
We've got this great resource, a really comprehensive local guide from the experts at Blood Test UK. It's focused specifically on Redhill and Surrey.
And our mission today is pretty simple.
Yeah, we want to give you a quick, easy way to understand your numbers and why they matter.
Exactly. Knowing those numbers is the best shortcut to managing your own health. It helps you stay healthy and, hopefully avoid some serious problems down the road.
Okay, so let's unpack that. For anyone listening, what is a diabetes test actually checking for? What's the core idea?
In really simple terms, it just looks at your blood sugar levels. That's it.
Your blood sugar.
Yeah. If your sugar levels are too high all the time, that's how doctors spot diabetes early. And catching it early is absolutely key.
Okay, that makes sense. But the Blood Test UK guide lists a few different tests. I mean, why so many? Don't they all just check your sugar?
That is a fantastic question. They do, but they each tell a different story. So you have the fasting blood sugar test. Think of that as a snapshot. It's one reading after you haven't eaten overnight.
Right.
But then there's the HbA1c test. Now this one is fascinating because it gives you the bigger picture. It shows your average sugar level over the last 2 or 3 months.
So it's like checking your bank balance today versus seeing your average spending over the whole quarter.
Exactly. That's the perfect way to put it.
And that long-term view must be so important. I know the guide mentions local experts, Dr. Sarah Thompson, I think.
Yes.
And she really emphasizes that catching this early can stop huge problems later on. We're talking about things like severe heart disease and even
Nerve trouble, neuropathy. It can be incredibly painful, and early testing is the best way to prevent it.
Which means getting the test has to be easy.
And it is. That's the best part. The guide from Blood Test UK really highlights how accessible it's becoming, using Redhill as a perfect example.
So where can people actually go?
Well, you've got your local GP surgeries, of course, like Earlswood Family Doctors or the Wallhouse Surgery. But it gets even easier.
Oh, you mean like the high street spots?
Exactly. You can just walk into Boots Pharmacy or Superdrug Pharmacy. They're making walk-in testing a normal thing. It just removes that barrier of having to book a special appointment.
And the technology is getting better too, right? The source mentioned these CGM devices.
Yeah, continuous glucose monitors. They are a game changer. They give you real-time feedback on your sugar levels right to your phone.
So you can see instantly how that slice of cake affected you.
Precisely. It empowers you to make changes on the spot.
Okay, so say you're going to get one of these tests, specifically the fasting one. What do you need to do to prepare?
This is probably the most crucial step, and the Blood Test UK guide is very clear on it. You cannot eat or drink anything.
Anything at all.
Well, except water. You can have water, but nothing else for at least 8 hours before the test. If you don't do that, the numbers just won't be accurate.
And once you get those numbers, what are we looking for here in the UK? What's the benchmark?
So in the UK, a fasting blood sugar level of 7.0 millimole L or higher is the number that indicates diabetes.
7, got it.
But listen, the number isn't the finish line, it's the starting pistol. The most important thing is to take that result and talk to your doctor.
Right, to make a plan.
Yes, a personalized action plan. Could be about diet, exercise, or maybe starting a common medication like metformin.
So, wrapping this all up, what this really means for you listening at home is that regular testing is getting easier and easier.
It is, especially in places like Redhill and Surrey.
And doing it translates directly into, well, just better health, a lower risk of all those awful complications we talked about, and a better quality of life overall.
And that really raises an important question for you to think about. Knowing that these checks are so quick and available right in your local area, what's one small preventative step you could take this week to really own your health?
A great thought to end on. And just a reminder, all this incredibly helpful localized info came straight from the guide compiled by the experts at Blood Test UK. That's all for this deep dive.